Hi, everyone. Welcome to the Boundaries and Belonging podcast, an arts-based approach. I'm your host, Magdalena Karlik.
You need all the voices.
To recognize someone's truth doesn't mean you have to invalidate somebody else's.
No one knows everything, including the instructor.
As educators, how do we support the experience of belonging in our classrooms?
When you allow yourself to be as human as possible, that's when you can really connect.
You are welcome to challenge where the edges are.
When I'm in the classroom, I'm going to be who I am.
My responsibility is to push the boundaries of what we know and what we do.
This is the Boundaries and Belonging podcast, where I interview educators from around the United States who are teaching the next generation of arts-based therapists. Hello. I am excited to introduce Dr. Adenike Webb. Thank
Hello.
you for being here. You've been a board certified music therapist for about 20 years, and faculty clinical education coordinator for the Creative Arts Therapies Department at Drexel, and co-host of the podcast Black Creative Healing.
Yep.
Yeah. Well, welcome. Glad to have you here. I'd love to hear, to start out with your thoughts about boundaries and belonging. I'm curious how you think about boundaries when it comes to your work as an educator, and where does belonging fit into this work?
Oh, wow. What those are good questions. So I'll start with boundaries. That's really interesting because I know I recognize them. I don't know if I'm always holding them like front and center, you know? I think I become more aware of them when I'm engaging with students who might be having a difficult time with the coursework or in class, like life matters are getting in the way of them being able to engage the way they would like in class. And the boundary I come up against is like educator versus therapist, you know?
Yes.
And ever since I was a teaching assistant, I remembered my supervising professor saying, "You are not the therapist. You are not the therapist. You are not the therapist." and I know that. But it's so easy to respond to the needs that I'm seeing from that lens of because I was a therapist long before I was an educator, and so trying to be like, well, hold up, I can be supportive, but I cannot support in this way. So I find that I'm always trying to do that dance. Like, am I too far over? Am I, because as an educator, my responsibility is to see that they can understand the material, they can apply the material, and they can go out and do what they need to do. Right. I'm not supposed to make the rest of their life kind of come together. So it's been interesting because I find like my heart goes out, to students, and I'm like, well, I can only, what do you need to do the work in this class? I'm happy to talk through adjusting things a certain way so you can engage the way you feel most comfortable and be successful. However, beyond that, please go to the counseling center. Please follow up with this person. Please follow up with that. So I'm always mindful of that as a music therapy educator.
Yeah, and therapeutic education can be confusing in that way for the facilitators, because there are always opportunities for the curriculum to offer, like a therapeutic experience.
Yeah.
Right. And so facilitating it really is a dance. You were doing a sway side to side. I really appreciate that, because it does feel like this dance,
It is. And for example, just this week I wanted to model some of the music therapy methods we engage with. So I'm teaching incoming students, and it's a graduate program at Drexel. And none of the students really have a music therapy background. They haven't done an undergraduate in music therapy. So they're coming into it pretty much brand new, with the exception of one, actually. And so I thought, I'll take time each class for the remainder of our term to do music experiences, and then kind of talk about like, okay, now how might this work in a music therapy setting? And I found myself being very cautious with like, okay, what songs am I choosing if we're doing a song lyric discussion? What songs am I choosing if we're just going to do a recreative singing experience, or recreative or a song parody if we're going to rewrite something? And then when I am engaging them in the music, am I telling them to engage with a particular lens, as in act as if you are, or do I just present like, so what I have been doing is like, hey, just we're going to do this, and you just come in, and I'll ask them questions like, what did you think of the lyrics? How did the music, what came up for you as you heard the melody or whatever? And so just getting them to react from their own personal authentic experience, but trying to be mindful of like, I can't really go into any processing if stuff comes up. For example, I used the song Lost Boy by Ruth B. I don't know if you're familiar with it. It's a very, it has like a sort of bittersweet, nostalgic feel to it, as the singer talks about being a lost boy from Neverland, always hanging out with Peter Pan. And it sort of evokes, escaping a difficult reality to an idealized place, and recapturing some of the joys and whimsy of youth, And, it's interesting. Somebody latched onto that, saying like, like life is not a fairy tale. Life is reality, and like I found that out. So were I a therapist, be like, well, tell me about your reality. But the class is not the space to dive into like, well, how different is reality from that fantasy you've created, and then there, students who felt like a tension from the music because of where they were in their current, their own lives. They noted they felt a discomfort with the music, and I acknowledged it and said, thank you for sharing that. However, were I the therapist, we would have like, okay, so where do you think that might be coming from? And so it's just trying to be like, I want you to engage with the music so you can understand how a client might respond, what might be coming up. But the next step I can't do with you, right? Because that's not ethical as an educator to go into that realm with you. I can tell you what can happen, how if you were facilitating this with a particular group of service users, how you might want to continue with this. But so it's a really interesting thing, and like just trying to hold it in a space where if we're engaging with music, it's kind of in this box, and it's pretty safe, it's pretty contained, and I can point out how things could possibly go, but I can't really let it go there. So.
And that's part of that's part of the boundaries. Like,
the
container includes some of that personal, the personal associations, the depth in the body, and yet to go any further would be outside of what your class offers.
Right. Exactly.
Yeah. I'm curious within this space that you create, how do you facilitate belonging? What does that look like, feel like, sound like?
I'll kind of go back to like the first day of class when we started with going through the syllabus and all that stuff. And I just basically shared where I'm coming from, so every now and again, my accent will pop up. So I let them know that, I'm originally from Trinidad and Tobago, how long I've been here, a little bit of what my journey to this point has been and how I see our time together. So I told them that like, I know a lot about stuff because I've had experience, doing certain things, but I'm by no means the expert. And you're going to come in and you're going to have experiences that will bring a lot of information, that it will inform how we understand things, So, yes, on paper, I'm responsible for this class and I have to give a grade. So there is that level of hierarchy in there that we can't totally ignore. However, as much as possible, I want it to be a space where we're all learning together and we're all sharing / teaching together, And I hope that we do it in a way that everyone feels respected and valued. So so that's kind of how I presented it. And I do my best to like I guess, affirm how people share things, say things, and comment. So like, they always say there's never a dumb question or anything like that. I don't use that term exactly, but like, I just like, ask your questions and we work it through. So like, for example, after I had them do the music experience as themselves, as I go, put on your therapist hat. What might say this was a particular group of service users ages 18 to 24. What might be a goal of bringing in this kind of song to have this kind of discussion? And for some people, it's the first time they're ever thinking of articulating a goal. So things are kind of nebulous and long until so like, okay, let's distill it, let's bring it down. And I say, okay, I like that you're looking at it from this angle, so how about we try to get to what's lying underneath it, so trying to not say like, oh, that's wrong or that's not a right goal, like, because there's so many ways of interpreting or expressing the same idea, the same concept when it comes to a goal. So just I try my best to accept what they give and work with them to refine it if it needs to get more aligned with what the concepts and objectives of the class are.
Yeah, that makes a lot of sense. And I hear in what you're saying is that you're offering an inclusive space where students really are invited to bring their questions, bring themselves, and that, that perspective around you're a learner too, as the educator, even though there is a hierarchy, that perspective of being a learner reduces the power dynamic a little bit. Is what I'm hearing you say. Yeah. I'd love to hear about the classes that you teach. What are you teaching? What do you love about teaching?
Oh wow. So this class I'm teaching is called Principles and Practices in Music Therapy. And it's the first music therapy. Well, it's not the first because they have other classes, but it's like the foundational overview kind of course. And I've taught it before at another institution, with another title, but it's pretty similar. But that was more for undergraduate students, and this is more graduate students. And I feel like when I look back, I don't think I made much of a distinction in terms of the content. I think both levels of students needed. I might have had different expectations for the assignments or whatever, but I just kind of believe like, this is what you need to know and I'll help you know it when it comes to getting these things. So that course, I really do enjoy it because it's brand new. You're like, what is music therapy? And then we get into these really cool, I love definitions. And at this stage, a lot needs to be defined because when you're talking about defining music therapy, you got to define music and you got to define therapy. And to understand those things, you got to understand what is health, and health is culturally situated, as is music. So what is culture and where are you situated? So like bringing all that in. And what if you have an understanding of music and health and therapy that differs from what your clients have or from what your facility that you're working in has? So what happens there? So I love having those discussions. They're so rich, and for some people, they might have already been on a journey of exploring those things. And for other people, it's like, oh, mind is being blown right now. And I hope it's not too overwhelming, but it's like, I think it's so rich. Like we had a great discussion about what is music. I said, how would you define music? And one student said, sound with intention. And I was like, okay, cool. And I didn't get a chance, but I was thinking, but a dog barking is sound with intention. The dog is making a sound with the intent of alerting another being to something. Do we call that music?
I mean, I don't.
And then I brought up the example, like some machines, for example, I like listening to the copy machine when it's doing like 20, 30, 50 pages, because there's a rhythm that happens. And, you hear all the little syncopations of the different pieces of the mechanism, doing its thing. So I found myself grooving to the copy machine. But is it music? So then we got into like, well, it depends on the audience. It depends on the intent of the sound producer. And so we can get into all these other different things, and maybe we need to bring all these things together. And I am so stimulated by that, because I feel like some of those things are things we take for granted. Like, we take for granted what health is, what music is.
Yeah.
But it can have such specific meaning to so many different people.
I love that description of the conversation that you have. I too really like taking apart concepts and pushing the boundaries of, you know, the expectation of what the concept is, and the spectrum of what is health, how we define health, or how we define relationship or art and music. Woo. Yeah. So rich.
And I don't know that we could ever really land on a definitive sentence that this is what it is, because I feel like everything's dynamic, you know, and contextual. Everything is contextual. So I often tell people, as much as I've been studying music therapy since 1997 and practicing, you know, I finished my internship like 2002. So I've been doing this a long time in a way. And every place I've gone, my definition of music therapy has expanded or shifted in some way, because music therapy looks different here in this place than it does over there in that place. And even if two of us are in the same facility, how person A does music therapy is different from how I do it. So it's like a different understanding and experience.
Ooh, I love that. It really is so inclusive. And I imagine that large perspective invites students to be authentic in how they learn music therapy, and then also how they practice it as future practitioners.
I mean, I want them to not just be excited about it. You know, a lot of people come into creative arts therapies because like their experience with the art has been transformative, and they want other people to have that experience, and that's wonderful. And I want that to stay. I also want them to not feel locked into doing music therapy as I do it, or as the textbook says to do it. I want them to be willing to experiment, willing to explore. Like every time when I was working full-time clinically, and I'd have practicum or internship students come in, I'd tell them in a kind of a way, this is an experiment. You know, feel free to do anything you want as long as you have a valid clinical reason to do it. So, okay, you heard this song on the radio, great. You don't just bring it in because it's a cool song. How does that particular song on the radio apply to the needs and the treatment journey of the folks here? You know, and once you can tie that in, like in service to what they need, sure, bring it in. And maybe it works, maybe it doesn't. But as a friend of mine says, worst case scenario, you'll learn something. So I always hoped I created a space where they felt comfortable enough to try things. And I found myself learning new songs and new ways of putting things together from students that I continued to do after they left. So I tell them that, you know, I do learn. I do learn from you, you know, and there's not one way to be. So yeah, that's what I hope they really walk away with.
And that there's not one way to be, and that they make an impact on you as the educator. Yeah. Wow, that's a real gift to share with them, I think.
Thank you. I hope so.
Yeah. I'm curious to hear how you define your responsibilities as an educator in this field. Like what comes to mind when you think about that word, responsibility?
Okay, so some obvious things come up, like they need to know some, you know, foundational tenets, like certain principles. You know, they need to know what this term means. They need to know what the 4 main methods are. They need to know what the treatment process is. So yeah, I know they need to know the essentials, but I also feel they need to know the state of the field the state of the profession as it exists. So what I do in one of my in like maybe the second class, I started doing this a few years ago, and I just remain committed to doing it. I'll pull up the American Music Therapy Association every year does a survey of members. They call it the workforce analysis and something else. So they'll send it out this year. So they send it out every year, but the results for 2023, you'll get like 2024, 25 or something like that. So there's a little bit of a gap just because of the time it takes. So I'll get that information. It breaks down certain things. For example, of the respondents, what percentage identify as white? What percentage identify as different ethnicities, Hispanic, non-Hispanic, Black, and so on? What percentage identify as LGBTQ? What percentage identify as non-binary or trans, and so on? And then I put up information for Philadelphia. So this is the city we're in. We see that our profession, which typically ballpark numbers, our profession is about 88% white, 88% female, more or less. But then when you look at Philadelphia, it's about, I think, 45% people of African American descent, maybe 40. It's high 40s. It's about 25% a city of people who speak English as a second language. It's about a little under 30% of people living at or below the poverty line. So to start putting things together, like, where are you? And look at this profession, look at this city, right? And if we take this profession demographic as the standard and we bring that into Philadelphia, what might some implications, what can come up? What might be the implications of that, And we don't dive into it deeply in the second class, but I just want them to be aware. Like, you've got to be aware of the state of the profession, one. Two, you've got to be aware of the states of the environment, communities that you're in, and the limitations of what has been done. So I really feel as an educator, my responsibility is to push the boundaries of what we know and what we do, right? And that's coming from a little bit from my experience as an immigrant. I came in, I was what, 18, 19. I started music therapy studies at about age 19. And coming from the Caribbean, as much as we get US top 40 radio and TV programs and stuff like that, there was still a lot of American music and things I did not know. So I come into the music therapy program and these songs are standards. How you mean you don't know A Hard Day's Night by the Beatles? How you mean you don't know this by the Rolling Stones? Or you don't know that Billy Joel song? So it's like, and not that was said with any malice. It was just like, that's just what they did. Now, of course, this is a music therapy schools in the US prepare people to be music therapists in the US. So I understand that you're using that. However, even within that, there is a wealth of music, of things that were not included when I was there. For example, I don't think I was taught a gospel song. I don't think I was taught a rap song. I don't think I was taught a salsa song in my training. You know what I mean? Now, I'm not saying that every program has to have that, but just to say that there was this kind of not hyper focus, but there was an exclusion. Like, anything else was other, and you kind of figured it out on your own. But what might be considered your centric American, like middle class white centric kind of pop music was the standard, So I feel as an educator, I need to tell people, like, you cannot limit yourself to that, because that does a disservice to your clients of all backgrounds. We talk about client preference as what drives our music choices. And so we have to be familiar with hip hop, with dubstep, and I'm not saying you can learn all those things all the time, but there has to be room in the curriculum where students can get familiarity with other things, and or at least be given the foundation so they know how to explore another genre or another culture's music in a meaningful, respectful way, because you can't know every song, you can't know every artist, right? but I feel like I have to talk to them about making a conscious effort to do that, and especially when people come from music backgrounds that might not be your standard classical, study classical music and all that sort of a thing. Please bring in that music. Like one of the assignments they did, which I inherited in the syllabus I had, was a music presentation based on the work done by an Israeli music therapist. I believe in the article, she was working with a group of Israeli and Palestinian folks. And so to explore like group cohesion, get folks getting to know each other, everybody brought in music. But it was like a playlist, but there were different ways you can do it. One was like chronologically, so music from when I was 2, 4, 12. One could be historical. This is when, I lost my first tooth, and now this is when I went to college, and now this is when I scraped my knee on the bicycle. So it doesn't have to be in order, but it could be really significant moments. Another could just be, hey, this is what I'm listening to right now. And another could be, this is my favorite music of all time. And so they present the music, and in that article, they also had like a lot of journaling that went along with it. It was like a more intensive process, but for the purposes of our class, they did a condensed presentation. And we were talking about creating a playlist, and I need to follow up with my students about that, about getting the playlist onto our Blackboard shell, because it was like, now we get to know a little bit more about people, and we shouldn't exclude that. Like, you don't have to divorce yourself from your music and your cultural background and the work that you do. It's all in how sharing that music serves the needs of the group or the needs of the clients that you're working with, So I want people to know they remain human as a music therapist. They're not a blank slate,
right? Right.
So you, as an educator, I think it's important for them to be aware of themselves as people and as therapists, and how the personal and the therapist intersect, and how that gets into working with the clients that they have. So I guess those are the biggest things that I feel responsible for them knowing.
Yes, I just can imagine how rich that is in the classroom, and how there's both the experience of seeing oneself represented in the music that's shared, and also learning outside of one's like box of experience,
Yeah.
Yeah.
I enjoy it. I mean, I hope they're enjoying the process too, but I'm really enjoying these classes.
And I bet you're getting some really great playlists also.
Yeah, I mean, I've heard music I would never have known to go search out, so I'm so glad I'm doing this, because I'm like, oh yeah, we need to follow up on getting that playlist together. So yeah.
Hearing about this assignment that you do with students, it makes me curious about what other assignments or directives that you do in class light you up as an educator, and also you get to witness transformation in your students around the work.
So one of my favorite things to do is assign an arts-based reflection. I did an arts-based research dissertation, and that was such a meaningful experience for me, that I was like, I'm just going to bring it in to anything I teach. So I started with undergraduate students, where at the other institution I was at before, they said you get a prompt. So, and the prompts just depended on what we were covering in class. And I invited them to use any art form. It did not have to be limited to music, even though we are music therapists. I invited them to try, since we have maybe 4 or 5 prompts, try a different one for each prompt. And so, like, for example, this term, the first prompt was, what would you like compose a message for your future self as you prepare to engage in this music therapy journey. And I listed something, I said, cover any two of the following. And I listed some points like what skills you hope to develop, what you might want to let go of as you come to this journey, what you might want to bring forward with you, and so on. And, I invited people to choose their modality. And I said, there's a written component to what you do. So regardless of whether you do creative writing, movement, song, or whatever, along with it, I want you to put a written piece that says why you chose that particular modality, how you felt engaging with the topic through that modality, and what insights, if any, came up for you. And I have found every time I do this, like students, just like, especially when we were doing it in a class that was focusing on music therapy in psychiatric settings, like it really increased the level of empathy people had towards others, and maybe even the compassion and appreciation they can show to themselves. I feel like maybe some folks don't articulate the insight that they get at or the impact that the experiences have, but I can see like something's different. You've had a little bit of a shift here, and I love it. And they're my favorite assignments to receive because everybody does something different, and I get to see how they're thinking, how they're feeling. They don't have to share these assignments with anybody else. It comes to me. They can be as raw as they want to be, and I just love it. Like I'm amazed at the capacity for creativity and affect that people display in these things. So that's my all-time favorite assignment to do.
That sounds really, really meaningful for everybody.
I hope so.
Yeah. And receiving the spectrum of possibility from our students it's also inspiring. Just like getting new music, it's like, wow, I didn't even imagine that this could happen, and you have made something new. Yeah. It makes me wonder a little bit about, when we do creative assignments with our students, whether it's in class or for homework, they're kind of like what we started talking about in terms of boundaries. There can be a breaking open. There can be a, revealing that happens through the creative process. And I'm wondering how heartache shows up in your classrooms or in the assignments. I'm wondering how conflict shows up in your classroom or in the assignments, and what that looks like, how you hold it.
Wow, that's a great question. I'll start with the heartbreak. I'm thinking back to when I was working more with undergraduate students, and there was an arts-based reflection that one of them did, and I was surprised at how into how much detail they went with their experience, because they wrote a song reflecting an experience they'd had with someone else and how that impacted the way they saw who they were. And I wasn't expecting that level of self-disclosure, nor that level of insight from that particular student. And I was really moved by how that was like a part of their journey of like making sense of what happened and healing from what happened, so I didn't it wasn't anything that was like traumatic to say like, oh, I need to refer you out to the counseling center right now, but I really was like moved and in a way like honored that this was part of the way they could make sense of what was happening. And it gave me more compassion for that student and how I could support them in the class, like, oh wow, you really went into it. Goodness, in terms of conflict, I have to confess I'm generally a conflict avoidant person, so I don't like conflict that much. But I'm learning more and more through my work with the podcast that I do. We have created like an online community where people get together and we talk about stuff. And one of the things that has come up is this idea of leaning into dissonance as a way of being in communities. I'm really grasping at that, like holding on to that. Like, okay, if I really want to be in community with folks, we gotta lean into the dissonance. So when conflict comes up, I can't really avoid it. Gotta find a way to be with it, you know?
Yeah.
I haven't had major conflict, but I've seen where like they're differing of opinions, or maybe someone might feel like they have the definitive answer about something, and their understanding of the content is what everybody else needs to have. And so I try in those situations, I always find something to validate. Like I appreciate the passion with which you hold this conviction or something like that. And I would like to poke at it a little bit and present you with this, or maybe point out that, okay, you're saying this, and I see where you're coming from. However, have you heard what this person is saying? Let's bring that let's examine that as well. So trying to find ways to be like, again, there's more than one way of being. There's more than one way of understanding. And while people may have more experience in some ways than others, it shouldn't be used to diminish somebody else's contributions or something. Yeah. So I've always, I'm not a very blunt person in the sense of like, you shouldn't have done that, you're wrong. That's not me. I'm more like, I don't know if it's gentle or if it's diplomatic or if it's kind of, let's ease into it. But I will let it be known that like, okay, we're not going to hold on to this. We're going to bring, so like that.
I hear what it sounds like you do is like you're kind of making a weaving in the classroom, like when conflict comes up.
I like that.
It's like, okay, you brought this in, and then this person brought this in, and then there's this here, and it's all really important, is what I hear you say.
Yeah. I mean, I like to listen to what people say, like, and give space for people to just share their thoughts stuff. Because I find like for me, a lot of times as I talk out loud, I start making connections about, oh, this is what I really am thinking. Oh, okay, now that makes sense. So giving people space to like put their stuff out there. And then I always feel like everybody has a truth, right? And there's a reason they're saying what they're saying. True. Now, their truth may not include somebody else's experience, but to recognize someone's truth doesn't mean you have to invalidate somebody else's, So I try to find ways where people can be like, we can share our truths, and we can hold the fact that there are multiple realities around this particular situation or whatever it is. I'm not trying to get people to agree, because that may never happen, but I hope people in class recognize that we have to be respectful, even if we don't understand or accept what somebody else is saying, but we have to acknowledge that it can exist in the space with us. So.
I mean, this is like micro macro talk that you're bringing in here. Sounds like really important life skills that are being facilitated when it comes to how do we hold multiple beliefs at the same time,
Yeah.
Kind of makes me hold the multiple beliefs that are clashing right now, and the pain that it can cause when people aren't listening.
Yes.
Holding space for that. Yeah. And then it leads me to the wondering of this thing that educators kind of have to do in higher ed, and that's specifically therapeutic fields, and it's gatekeeping. And the term itself, right? There's sounds that go with that term because it has. There are at least I have some associations with that term that don't feel good. And I'm curious, what is gatekeeping to you, and how does it show up in your work as an educator?
Wow. This is so interesting because we're actually I'm part of a task force, so to speak, a little committee at my department that we're looking at coming up with some professional disposition so we can have in our student manual, basically, this is what we expect when you come into the program and what you can be like when you leave, you know? Because at the end of the day, they have to meet certain standards, especially if you're going for licensure. You have to display certain kinds of knowledge, certain kinds of skills. And that is also tied into like beliefs and attitudes and values and so on. So I think gatekeeping, I've been prior to this moment, as in like this time of my life, I was a little bit more on the side of like, well, yeah, not everybody can be a rocket scientist. Not everybody can be a football player or basketball player. So not everybody can be a music therapist. So they don't meet XYZ. You're not a music therapist, you know? And I still think that not everything is for everybody, right? And at the same time now, I feel like, how do we, like, there has to be a different kind of allowance, especially when we're getting students who are more open about having maybe invisible disabilities that might have previously shown up as a behavior or attitude that we think is not suitable for the field. You know what I mean?
Yes.
So I've been reading, like, in preparation for developing these dispositions, that we were reading different pieces of literature, and that was something that came up. It was a group of social workers, really, who were looking at, you know, how do you set up these things, and they referenced cases where people were dismissed from a program and then were challenging that, took it to court and stuff, because really and truly they might have had mental health issues and did not receive the kinds of accommodations that would have allowed them to successfully complete the program, because the way their mental health needs were surfacing were seen as a deficiency, you know? So that's the thing to kind of look at, like.
So you're talking about the ableism that is woven through dispositions in therapeutic education. Is that what we're talking about? Wow.
Yes.
Yeah.
So and I mean, like I said, we do have to have standards. Like, for someone to be a therapist, I do believe they need to have certain mindsets and values and abilities, because you're working with very vulnerable people, right? Whether they are in a particular kind of institution or something, whatever. Most in our society, people seek out therapists at their most vulnerable moments, right?
Yes.
So if that is the case, you have to be, there has to be a standard of like, this is the kind of acceptable, safe, ethical treatment that is provided, and are you able to provide that, you know? Now, I think we need, as students come into the program, they might understand that, and we have to adjust the expectations as they learn more, that we will expect to see more of certain kinds of things. However, we cannot be ableist to be like, well, because this person is showing this kind of behavior or this thing, they really aren't qualified. But if they're telling us that they have a need that so it's a really sticky thing. Like, it's a double-edged sort of a thing. My goodness.
It really is. And we're also talking about the possibility of students who are learning about their neurodivergencies, their mental health challenges. They may be just at the beginning of the journey of learning. And so being able to communicate needs around accommodations, or having the support to communicate those needs, can be challenging. The student might not be there yet.
Yes. Yes. Yeah.
Yeah.
So it's really interesting. It's really, really interesting. It's I don't know what's the thing to do. I mean, every creative arts therapies discipline has their, they have their certification, and then those who like also get the LPC, they have that, and then there's continuing education you need to do to maintain all these things. So so one can hope that there are safeguards in place that will keep people at the level of knowledge and skill required for the work that they're doing. And at the same time, like, you know, we have to make room for people who may not have fit what we initially thought was the standard of a therapist, but are still doing the kinds of things necessary in the therapy setting. So it's really interesting.
Mm-hmm. Once again, I hear from you that like the importance of expanding the space, bringing more in, inclusive, practices. Mm-hmm. Yeah.
And it all sounds so beautiful. And sometimes it seems like it's a simple implementation. Mm-hmm. And other times it's just not.
No.
But I don't think we should abandon the effort because it's not a simple solution. Mm-hmm. And I think, on our way to figuring out how to be more inclusive, less ableist, and still, providing the caliber of therapists that will truly, that is competent, so to speak, to do what needs to be done. Like, I feel like we have to own that we will make mistakes, but we keep learning from it. I feel like we need to be more receptive to input from students, not get, I'd be willing to take the feedback, be willing to sit and dialogue with them, and it may not always be pleasant. They may have to point some fingers at us for a little bit, and
they do.
And that's not fun, but I don't know. We have to commit to doing that.
Yeah. So letting that like role as expert kind of just, dissolve perhaps, or at least like loosen a bit, so that our students coming up can teach us,
Absolutely.
Mm-hmm. It makes me wonder I would imagine that this is one of them, but what are the challenges of working in higher ed in music therapy field or in creative arts therapies field?
Well, for one, time. Time. Not just from the standpoint of like me as an instructor preparing and grading and all those things, but even for the students. So at Drexel, it's a 2-year program traditionally. Some people might do 3-year, but if you decide to come in and do it for 2 years, you're in class nonstop from September of 2023 until June of 2025, because you do take classes over the summer, Mm-hmm. I mean, granted, they may not be you're not physically meeting every week, and they might end before like August or whatever, but like you're going to class every quarter. Mm-hmm. And sometimes there's quite a lot of a load, in each term, except for the summer term, maybe it's a little less. So I really feel the pressure of time, because we want students to, well, you need to know this, you need to know that, and you have to have this, and you have to have that. And you have to have time out in the field, engaging with therapists who are doing the things you want to do.
Right.
So I think time is one of the challenges. As I was talking about, but this idea of taking input from students and like reconfiguring our curriculum a little bit in terms of pulling out the embedded ableism, because I know like some of my music therapy colleagues and I have been talking about that. A lot of times music therapy has been embedded in like a medical model, which very frequently looks at disability as a deficiency, and now we have disabled music therapists challenging that. Like, neurodivergence is not a disability. No, I mean, not like a deficiency. Having a physical disability, being deaf, being blind, being whatever it is not a deficiency, and we need to shift how we talk about those communities and how we engage with those communities. I was fortunate to have the opportunity to be a guest editor along with one of my colleagues, Dr. Sangeeta Swami, for an an issue of Music Therapy Perspectives, one of our journals. It came out December. It was focusing on social justice in music therapy. And one of our aims, and I'm glad we were able to accomplish it, was to highlight the voices of marginalized or minoritized therapists in our field who are doing various kinds of work on research, scholarship, and clinical work. And we had a wonderful array of submissions. And what we ended up having, I mean, we couldn't include everybody, but what we ended up with, we had some beautiful, really reflexive, critical, and challenging articles about disability. There was one article by a music therapy educator out of Canada who's, she is blind, and she talks about, I believe the title of her article was Performing Normal, and looking at how her journey as a musician and into music therapy really kind of, like, at the beginning was this attempt to be normal, and what does normal mean, and how that kept her from seeing being disabled as a way of being in the world, a valid way of being in the world, and what knowledge comes with that, what experiences come with that. And then we had a group of music therapists, I think they were from like Australia and New Zealand, who identified as disabled with a variety of disabilities, talking about their experiences working with similarly disabled clients and changing the narrative around disability in music therapy. We had articles looking at race and supervision of music therapy students, and like so it was really, really awesome. I was so grateful to be a part of that. So I feel like some of the challenges we have partly do with time, partly do with our curriculum, is that we don't get to always highlight the things we need to highlight now, the things that are coming up, because the demographic of our society is shifting, and people, and the way people engage and talk about things is shifting, so like,
True.
It's more apparent now where people will talk about receiving mental health services, or people will talk about identity and different aspects of identity. Like, so we can't not address that, and how that comes into play in music therapy training and treatment. So it's like, so that's one of the challenges, is like, we need not to throw out entirely the curriculum because it served a purpose, but recognizing that we have to shift to be better, to be responsive, to be responsive to what's there. So that's definitely a challenge. And then money's always a challenge in higher education. Like, to be able to have all the funds to bring in all the speakers you want, or get certain materials and resources. I mean, we do the best we can. Like, everybody's limited by that, but that's really interesting too.
Yeah, and I imagine that within that there's a lot of creativity.
Yes. Yes.
Yeah, a lot to think about when it comes to how to keep revising curriculum, how to keep learning. Like, it's like this active process of learning from the students, from the community context, from oneself, and bringing it all together over and over, right? It's not a static process. It continues to evolve.
Right. So, like, one of the challenges, so I've been talking primarily from my role as music therapy faculty, but I'm also clinical education coordinator.
Right.
So I have to find clinical placements for all the creative art therapy students in our program, right? And there are limitations, of course. There are only so many so many dance movement therapists, so many art therapists, whatever. And then there are also other schools in the area providing these programs. So there's a little bit of competition for sites.
Right.
So what we were thinking, so then the idea came up, like, can we do any telehealth sorts of placements? Who is offering it? Now, that was a thing during the height of the pandemic.
Right.
Everything went online, but now people are primarily back in person. So there aren't as many options for telehealth training sorts of experiences for students. And some of our professional associations that approve our programs and determine the standards of education don't really have provision for that right now,
Mm-hmm.
or for other ways of incorporating technology into our experience training and so on. So I feel like another challenge is like we want to respond to what the community needs, but we still have to line up with the mandates and standards of our professional associations, and it takes time for them to shift, right?
Boy.
So we are seeing, like, if our students have more telehealth exposure, that's gold, but they can't have as much, or there aren't opportunities for that. So that's one of the challenges I find too.
Mm-hmm. Yeah, what a big shift. I mean, we shifted in one direction, like everything online, school online, which was wild. I mean, I know it was wild in my experience, it was, woo. And then, of course, students doing practicum and internship online, and really having to shift thought process around ethics and distance and how we show up in the screen, and of course how our body feels in this position, et cetera, et cetera. And now the shifting back, or choices to not shift back, is really interesting. And I thank you for sharing your experience around it, because I think that my experience here in New Mexico is that there's a lot of telehealth options. There's a lot of telehealth practice happening for art therapists in town and counselors. So it's interesting, but I'm in a different part of the country.
Right. And then there's some interesting limitations of the technology. So
True.
With music therapy, if you're doing live music over Zoom, for example, and certain other platforms, it's really challenging. Like I was doing during the height of the pandemic, I was seeing a group of women in a substance use recovery program. So we went to telehealth, and it was either 10 people in the room, one computer. So for me to see as many people as possible, the computer's on the mantelpiece of the room.
Yeah.
But I can only see 3 people in the screen. And then if somebody off screen says something, I'm like, can you get in the screen and say it again? And then if I'm playing guitar or piano and they want to sing along, it gets into that funky lag. So it's like, okay, if you're going to sing with me, turn off your mic and just, sing along with what you hear. And so there's that kind of barrier into being with each other in the music that way. Yet on the other hand, if we were using a lot more music production software, which would probably be a little bit easier one-on-one with a group, maybe if everybody was on their own individual computer. So that's another question, access. But anyways, access to these resources. But if we had we could be writing songs, composing songs, using software and so on, and a lot of people did that. So just rethinking, like, what are the skills you need to have as a music therapist in this time, given what's been happening in society. And we at Drexel, we do have a music technology class, but that's just like one class. We're still like focusing on, you need to have the guitar skills and the piano skills, which you do. So it's just like, how does our professional association revise or adapt standards of education to reflect this need, and what does that mean for our curriculum? So yeah, like being caught in that space, like we see what the community wants and needs, and you're not there yet.
Got you. Again, that evolution to meet the needs of where we are in this time. Yeah. Interesting. I wonder how things will change.
I think they will come around because they'll have to, right? If we plan to be relevant to the society, to the landscape, to the promotion of well-being, we're gonna have to, so it's just a matter of, like you said, just a matter of time and advocacy and investment in the infrastructure to allow for that. So yeah,
my fingers are crossed. Well, I would love to end with a little bit of a pivot towards hearing your experience of what emerges when you're working with your students. When everybody is in a flow state, whether it's listening together or creating together, and this new thing emerges. And I'm just wondering, how would you describe that and how it feels and what it sounds like?
Wow. Gosh, it's like so I'm thinking to this last class on Tuesday, we did a song parody experience. It was like a Mad Lib. So I took out certain words from a song and they had to replace them to make it about them. And they opted to go with being kind of goofy, which was fun, because that's all valid. And I enjoyed like seeing the shift in energy in the room and seeing people start to give themselves permission to be goofy. Because at first you could tell people were like, well, we should be saying like that doesn't make sense. Because I think the first thing was, looks like a lizard, but it's a gecko, I think was the line they came up with, or something like that. And so people are kind of, what are you gonna, but like once they could realize that part of creativity is play, part of creativity is fun, and that's valid in our process, like people just loosening up. And so it feels like, I guess, like an expansion. There's more room. I think what I hear and feel is like wind kind of blowing in, and it's like not a harsh wind, but there's energy, there's direction, and it's like refreshing and uplifting at the same time, like, oh yeah. So that's what it feels like.
Oh, that was great. Thank you.
You're welcome.
Yeah, I could experience it as you described it. Yeah, what a joy. Thank you so much for spending time with me.
Pleasure. Thank you for having me.
Absolutely. Yeah, I learned a lot, and there'll be a lot to ponder.
Well, thank you for this time and space. I really enjoyed being able to share these ideas and stuff.
Absolutely. Thank you for listening to the Boundaries and Belonging podcast, an arts-based approach. Please tune in, subscribe, follow. We're on Instagram at Boundaries Belonging Podcast. I want to thank today's guest for their wisdom, laughter, and movement, and also a big thanks to my brother Gabriel Karlik, who's in charge of the music. See you soon, and keep creating.